On the front line of the outbreak, every day these health workers come into direct contact with people infected with COVID-19. But as coronavirus cases appear to spread fast across Africa, there are warnings from officials that the risk they face is increasing.
We know the number of infections, but we don't yet have the exact counts of those that have died because of the COVID infection. Many countries are reporting a large number of patients that are asymptomatic, which is a good thing, which means, but we now know that countries are beginning to see their hospital systems overwhelmed because they need to manage that.
The World Health Organization says health workers with COVID-19 make up more than 5% of cases in 14 countries in sub-Saharan Africa alone. And in total, more than 10,000 medical personnel on the continent have been infected. The World Health Organization says the risk for health workers is heightened by inadequate access to personal protective equipment and also weak infection prevention and control measures in many countries. They and the Africa CDC are asking countries to invest in more PPE and facilities through an online portal that the Africa CDC has created that links countries directly to credible manufacturers. There are also warnings about other challenges medical staff face.
They also suffer psychological pressures from working around the clock. We have seen in countries where the situation is serious how hard the healthcare workers, the doctors, the nurses, and others are working. And in some communities, they face stigma and discrimination because of fears and misinformation around this virus.
Some hospitals have organized special programs to try and keep their workers motivated, but others are left to cope on their own. Africa is now closing in on 1 million cases of the virus, and the concern is that without more physical and mental support, medical staff trying to fight the virus will end up battling their own health problems. Coletta Njohi, CGTN, Addis Ababa, Ethiopia.